On this testicular ultrasound, how many of these findings per transducer field are considered abnormal? We see numerous, non-shadowing, discrete, punctate calcifications measuring 1 to 3 millimeters in size. There's no associated mass effect. The answer is 5, and the diagnosis is testicular microlithiasis. It's seen in about 0.5% of the population. The presence of 5 calcifications, seen as small hyperechoic foci on a single image, is considered diagnostic. Composition is usually hydroxyapatite, and these microcalcifications are located within the spermatic tubules. Majority is idiopathic, but previous infection or trauma may be responsible. Clusters of microliths may represent a testicular tumor, so pay attention for any associated soft tissue mass. If there's no soft tissue mass, then this is usually a benign finding. High-resolution ultrasound is the modality of choice. In terms of the differential, consider neoplasm, especially a large, calcifying sertolid cell tumor. Scrotal porals or scrotoliths are another consideration. These are extratesticular calcified bodies within the scrotum, possibly a result of tunica vaginalis inflammation or torsion of the appendix testis. Lastly, consider a testicular granuloma. The clinical significance is that there is a possible germ cell tumor association. For example, here, on this sagittal-colored Doppler ultrasound, the blue arrow shows a large hypoechoic mass with internal vascularity. The white arrows show a background of microlithiasis. Pathology confirmed a classic seminoma. The presence of microlithiasis alone, in the absence of other risk factors, is not an indication for regular scrotal ultrasound. But if there are risk factors such as personal or family history of germ cell tumor, maldescent or undescended testes, or an underlying syndrome such as Klinefelter's, Downs, or Peutz-Jeghers, then ultrasound may be needed. In this separate case, we see extensive microlithiasis, which limits adequate assessment of the testicular parenchyma. And here's bilateral testicular involvement. Distribution may be asymmetric. If there's no soft tissue mass, these findings are again not palpable, and they're benign. You now know a lot about testicular microlithiasis. Please subscribe for more awesome anatomy and radiology videos.